Pop culture often frames hallucinogens as tools for casual mind experimentation, substances that, unlike other drugs, don't build habits or create dependency. But for some, occasional use slips into a repeated cycle. The substance starts requiring more time, more energy, and eventually the negative costs in daily life begin to pile up. When that pattern locks in, it enters the territory of hallucinogen use disorder, a fully recognized clinical condition outlined in the DSM-5. Look at this 1899 edition of Merck's Materia Medica. Historically, medical science categorized chemical substances based almost entirely on their immediate physical effects on the body. Because a disorder involving LSD, psilocybin, or PCP rarely involves the severe physical withdrawals seen with other drugs, people struggling with it often fall into a diagnostic blind spot, feeling alienated or entirely invisible to the healthcare system. Brushing off these patterns as a harmless phase keeps individuals from recognizing they are dealing with a legitimate, treatable disorder. While only a licensed clinician can formally diagnose hallucinogen use disorder, the medical community looks for 3 specific markers to see if the threshold between casual use and disorder has been crossed. This chart shows the biological threshold. Notice the line for a rising tolerance, where a person needs larger amounts of the substance to feel the same effect, often accompanied by intense cravings between uses. Then, the pattern reaches the behavioral threshold. This happens when use continues in physically risky situations, or when it actively strains a person's performance at work, school, and their close relationships. Finally, there is the perceptual threshold, characterized by lingering visual or perceptual changes that persist long after the substance itself has left the nervous system. The presence of these 3 markers reveals that this is a complex, systemic behavioral issue, requiring a different approach than a standard physical detox. If there are no severe physical withdrawal symptoms to mitigate, clinicians have to use a completely different set of tools to treat the disorder. This diagram maps out the triad of evidence-based psychological treatments for the condition: cognitive behavioral therapy, motivational interviewing, and contingency management. Together, these therapies straighten out tangled, destructive thought processes and rewire behavioral habits, directly targeting the psychological loop of the disorder rather than managing physical symptoms. For these interventions to succeed, the clinical environment has to be rooted entirely in empathy, meaning 0 lectures and 0 judgment. Successfully treating the condition relies on this highly specialized psychological model and skips the traditional drug rehab playbook entirely. Yet, all of these evidence-based treatments fail if a person cannot access them because they live too far from a specialist or cannot afford the sessions. Coping and healing counseling solves this by delivering care through a 100% HIPAA-compliant, secure telehealth model. By moving the clinic to secure video, they provide access to care across all 159 counties in Georgia. Their extensive network includes over 15 licensed therapists, LCSWs, LPCs, and LMFTs, who are culturally competent and equipped to treat individuals, couples, and teens 13 and older. They also tackle the financial hurdle directly. For Medicaid patients, treatment comes with a $0 copay. For individuals with commercial insurance plans like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, or Humana, out-of-pocket costs run just $10 to $40 a session. With secure video and accessible pricing in place, geography and financial strain no longer keep people from getting the support they need to reclaim their lives. Reach out to Coping and Healing Counseling today by calling 404-832-0102, visiting chctherapy.com, or emailing support@chctherapy.com to start your path forward.